Have you ever wondered what doctors really think when they're treating older patients? I mean, deep down behind the kind smile, the quick nod, the scribbling on a chart, what's really going through their mind? Are they as compassionate as they appear? Or is there another side that seniors rarely hear about but quietly feel every time they walk into a hospital room? Think about it. You've lived a full life, decades of experiences, struggles, and victories. You've raised families, built communities, worked hard, sacrificed, and survived. And yet, when you sit in that cold examination chair, sometimes it feels like all of that disappears. Suddenly, you're not a person with a story, you're just a number, a case file, another old patient. Have you ever felt that? That moment where you're talking but you can tell they've already made up their mind about you? The truth is, the way doctors see older people affects everything. The kind of care they give, the advice they share, the way they explain, or don't explain, what's happening to your body. For some seniors, these hidden truths are the difference between living with dignity or slowly feeling invisible. And that's why this video matters. Because today I'm going to share with you 5 ugly truths about how doctors really view older patients. Some of these will shock you. Some might break your heart. But every single one of them will open your eyes. And here's the thing. Once you know them, you'll never look at a doctor's visit the same way again. You'll be better prepared. You'll know the signs. And most importantly, you'll know how to protect yourself or someone you love. But before we dive in, I want to ask you something personal. Do you believe seniors deserve respect in healthcare? If your answer is yes, I want you to write 3 simple words in the comments right now. I care. Because your voice matters, and when you comment, you're not just typing words, you're standing up for every older person who has ever felt ignored, dismissed, or treated unfairly. And while you're at it, make sure you hit that subscribe button to join our community here at Elderly Advice for Life. Because here we believe every senior deserves comfort, dignity, and truth, not sugar-coated lies. So take a deep breath, lean in, and get ready. Because once you hear these 5 ugly truths, you'll never forget them. Let's start with the first ugly truth. And it's one that so many older people have felt but maybe never said out loud. Doctors sometimes see seniors as hopeless cases. Picture this. A woman in her early 80s walks into a clinic. She's moving slower these days, her knees ache when she tries to get out of bed, and the pain keeps her up at night. She explains all of this to her doctor, hoping for a plan, hoping for relief. But instead of digging deeper, instead of exploring what might actually help her, the doctor just leans back and says those 4 words so many seniors dread hearing: that's just old age. Now think about how that feels. You've worked hard your whole life. You've been through struggles and storms. You finally ask for help, and what you get in return isn't compassion, it's dismissal. As if pain is just your new normal. As if you should just accept it because your years are catching up with you. Here's the truth the medical world doesn't always admit. Yes, aging brings changes. Our joints wear down, muscles weaken, energy doesn't flow the way it used to. But that doesn't mean every ache and pain is untreatable. Many of these issues can be managed, eased, or even improved. Arthritis, chronic back pain, sleep struggles, these are not simply things to accept. They are conditions that deserve care, just like any other illness at any other age. The problem is that some doctors fall into a dangerous habit. Instead of treating the person sitting in front of them, they treat the age. They look at the number, not the human being. And that number tells them, why bother? Nothing much can be done. And here's where families often make a heartbreaking mistake. They believe the dismissal. They think, well, if the doctor says it's just old age, then I guess we shouldn't push any further. So they stop asking questions. They stop advocating. And slowly their loved one suffers in silence, living with pain that could have been eased. But let me tell you something you need to remember. You are never too old to deserve comfort. You are never too old to deserve proper care. If a doctor ever tells you, there's nothing to be done, don't just nod and walk away. Look them in the eye and ask, what can be done to improve quality of life? Those words matter. Because quality of life is not just for the young. It is for everyone, at every stage, at every age. So here's my advice. Never settle for nothing. Push for answers. Explore alternatives. Sometimes it's a different medication, sometimes it's physical therapy, sometimes it's small lifestyle changes. But there is almost always something that can be done to bring relief, to restore dignity, to make everyday living just a little lighter. And if one doctor makes you feel dismissed, don't be afraid to seek another opinion. Because your life isn't a lost cause no matter how old you are. But dismissal isn't the only problem. In fact, sometimes seniors face the exact opposite issue, and that's where the second ugly truth comes in. Now let's talk about the second ugly truth. And this one hides in plain sight, right there in the little orange bottles lined up on the kitchen counter. Over-medication. Imagine this. A senior leaves the doctor's office with not one, not two, but 6 different prescriptions in hand. Blood pressure pills, cholesterol tablets, pain relievers, something for sleep, something for digestion, and then another pill to deal with the side effects of the first 5. By the time they get home, their pill box looks more like a pharmacy shelf. At first glance, it feels reassuring. After all, if the doctor gave all these medications, it must mean they're being thorough, right? It must mean every problem is being addressed. But here's the hidden danger. When the body is already fragile, when the liver and kidneys are slowing down with age, every single pill has weight. Every single pill has a price. And the truth is, many doctors don't always stop to look at the full picture. One specialist prescribes something. Another adds their own. A third tweaks the dosage. But who is stepping back to ask, how do all of these interact inside the same body? That's what we call polypharmacy, and for seniors, it's one of the greatest silent dangers. Dizziness, memory problems, constant fatigue. Sometimes families think these are just signs of aging. But in reality, they can be side effects of medications working against each other. I can't tell you how many times I've heard of seniors collapsing or feeling lost, only to discover later that it wasn't just old age. It was the medication cocktail they were taking every single day. And here's the misconception so many families fall into. They believe more medicine means better care. They think a long prescription list equals thorough treatment. But often the opposite is true. More medicine doesn't always mean more health. It can mean more risk, more confusion, and sometimes more harm. So what can you do? You ask for something most people don't even know they can request: a medication review. Sit down with your doctor or pharmacist and say, can we go through every pill one by one to see what's really necessary? You'd be surprised at how often something can be reduced, replaced, or removed altogether. Because sometimes less really is more, especially when it comes to your health. And while too many pills can quietly harm seniors, there's another truth that cuts even deeper. It's when the very thing that should protect you, medical care itself, fails to see the warning signs your body is giving. That brings us to the third ugly truth. Doctors sometimes underestimate seniors' pain. Picture an older man sitting in an emergency room holding his chest. He says it hurts, but the doctor waves it off, saying, it's probably indigestion. Go home, rest, you'll feel better tomorrow. But tomorrow never comes the way it should. Because 2 days later, it isn't indigestion at all, it's a heart attack. This happens more often than people realize. Seniors' bodies don't always send the same signals as younger patients. A young person with a heart attack might clutch their chest and collapse. An older person might just feel a little tired, a little short of breath, or vaguely uncomfortable. And because the signs look different, doctors sometimes underestimate how serious the pain really is. And families too make the same mistake. They think, well, grandpa's just old. Of course he's going to hurt. But pain is never just part of aging. Pain is your body's alarm system. And if the alarm is ringing, there's a reason. So here's what you need to do. Be clear. Be specific. Don't just say, it hurts. Say, it's a sharp pain. It's constant. It moves down my arm. It gets worse when I stand up. The more detail you give, the harder it is to dismiss. And whenever possible, bring someone with you to appointments. An advocate who can speak up if you're not being taken seriously can be the difference between being brushed aside or being properly treated. Because your pain matters. Your life matters. And no doctor, no matter how busy, has the right to minimize what you feel. But what if the real issue isn't just medical at all? What if it's about how seniors are seen, not as patients but as people? That's where the next ugly truth comes in. Now let's move to the fourth ugly truth, and this one cuts deep because it's not just about medicine, it's about respect. Age bias. Picture this. An older woman sits in a doctor's office, patiently waiting for her questions to be answered. But when the doctor finally walks in, he barely glances at her. Instead, he turns to her daughter, standing beside the chair, and begins talking directly to her. He explains the diagnosis to the caregiver, asks the caregiver the questions, and makes the caregiver feel like the true patient. Meanwhile, the senior herself sits silently, listening as if her voice doesn't matter anymore. Does that sound familiar? It happens more often than you'd think. And it's not just rude, it's harmful. Studies have shown that older patients are given less eye contact, fewer explanations, and less time to speak for themselves compared to younger patients. It's as if the moment you cross a certain age, the world assumes you can no longer speak for yourself. Now here's the problem. Families often think this is helpful. They assume the doctor is just being efficient, making things easier by addressing the caregiver. But what it really does is strip away independence. It makes seniors feel invisible, like their voice carries no weight. And when your voice is ignored, so are your needs, your feelings, and your dignity. So what should you do? Speak up. If you are the patient, it's okay to say politely, "Doctor, please talk directly to me." And if you are the caregiver, make room for your loved one to speak. Encourage them to ask their own questions, share their own concerns, and be part of the conversation. Because being old doesn't erase your right to be heard. In fact, your voice is more important now than ever. And finally, we come to the fifth ugly truth. Perhaps the hardest one of them all. Time pressures. Let me paint a picture. You've waited weeks, sometimes months, for an appointment. You finally sit down in that exam room with a list of worries in your mind. But before you can even settle in, the doctor is glancing at the clock. 10 minutes, maybe less, is all you get. They rush through a couple of quick questions, check your blood pressure, maybe write down a prescription, and then they're gone. You leave the office still carrying half the concerns you walked in with. This happens because doctors are under pressure themselves. Many of them have quotas, schedules packed so tightly that each patient is just a block on a calendar. But here's the sad irony. The people who need the most time, seniors, are the ones often given the least. Older bodies are complex. Symptoms overlap. One problem can be tied to 3 different causes. And yet, the clock doesn't bend to allow that deeper care. And here's the misconception families often fall into. They think a short visit means nothing serious was found. But that's not always true. Sometimes big issues are missed simply because there wasn't enough time to ask the right questions, to really listen, to dig deeper. So here's my advice. Never walk into an appointment unprepared. Write down your top 3 concerns ahead of time. Keep it short, keep it clear, and bring that list with you. That way, even if the time is limited, your most urgent needs get addressed first. Don't let the most important issues be lost in the rush. Because your health deserves more than 10 minutes on a busy schedule. Your life deserves attention, not leftovers. Hearing these truths can feel discouraging. I know it can weigh heavy on your heart. But here's the perspective shift you need to hear. It's painful, isn't it? To realize that seniors, the very people who built the foundation of our families and communities, aren't always treated with the respect they deserve. To see a loved one dismissed, rushed, or ignored by the very professionals who are supposed to care for them, it can feel like a betrayal. A quiet kind of heartbreak that lingers long after you've left the doctor's office. And if you've ever sat in that chair yourself, hearing a doctor talk over you or brush aside your pain, or hand you yet another prescription without really listening, you know how heavy that moment feels. It's not just medical. It's personal. It's the weight of being seen as less than you are. But here's what I want you to remember. Knowing these truths arms you with power. They may be ugly, yes, but they are not meant to crush you. They are meant to prepare you. Because now you know what to look for. You know what questions to ask. You know that you don't have to sit silently while your dignity slips away. You do not have to accept neglect. You do not have to accept bias. You can stand tall even in that examination room and say, I deserve answers. I deserve respect. I deserve care that values my life. And you're right to say it, because every senior deserves those things. So if you've seen any of these happen, to your mother, your father, your partner, or even to yourself, don't stay silent. Speak up at the next appointment. Write down your questions. Ask for explanations. Demand that your concerns be taken seriously. Sometimes it's not about fighting harder, it's about speaking with quiet firmness, reminding your doctor that seniors matter, that you matter. And I want to leave you with this. Yes, the healthcare system isn't perfect. Yes, there will always be challenges. But love, awareness, and persistence can change the way seniors experience care. Families who stay alert, who advocate, who refuse to let dismissal be the final word, they create a safety net that no system can strip away. Because while the world may rush, while some doctors may look past the wrinkles and gray hair, there is still dignity waiting to be protected. There is still comfort to be found. There is still hope for a life lived with respect. So don't give up. Don't lose heart. With knowledge, with love, and with a voice that refuses to stay silent, you can help create final years that are not filled with fear or invisibility, but with peace, comfort, and honor. So, before we close, let's take a moment to step back and look at what we've uncovered together today. The 5 ugly truths we brought into the light were these. First, how easily seniors are dismissed when they try to speak up. Second, the danger of over-medication, where too many prescriptions can create more harm than good. Third, the heartbreaking reality that pain in older adults is often underestimated or brushed aside. Fourth, the age bias that creeps into the exam room, making seniors feel invisible. And fifth, the rushed and pressured appointments that leave important concerns unheard. These truths are not just theories, they are lived experiences for so many families. And if you recognize even one of them in your own life, don't ignore it. Awareness is the first step to change, but action is what turns awareness into protection. Now, I want to hear from you. Out of these 5, which one feels closest to your own experience? Have you seen a loved one dismissed? Have you felt the weight of too many pills? Or maybe you disagree with some of what we discussed. Either way, your story matters. Share your perspective in the comments, because when we talk openly, we create a community where no one feels alone in the struggle. And if this video gave you clarity, if it gave you tools, or even if it simply gave you comfort, I invite you to take one small step. Give it a like and subscribe to Elderly Advice for Life. Every week, we create videos designed to empower seniors and families with practical truth, the kind of knowledge that helps protect dignity, health, and peace of mind. By subscribing, you're not just supporting this channel, you're joining a movement that believes older adults deserve to be heard, respected, and cared for with compassion. Thank you for spending this time with me today. It takes courage to confront the hard realities of aging in healthcare, but it also takes love, and I can hear that love in you because you're here learning, preparing, and fighting for better. So stay strong, stay informed, and remember this: your life and your loved one's life deserve nothing less than respect and dignity. Hold on to that truth, carry it with you into every appointment, every conversation, and every decision. I'll see you in the next video.